I'd like to say hello to everyone and welcome to part 4 of our Comagine Health learning series, Working Together to Prevent Sepsis. The series is brought to you by the Comagine Health's long-term post-acute care team, also known as LTPAC. My name's Connie Lauder, and I'm an improvement advisor with the LTPAC team. And today's session is being recorded for on-demand viewing for those who are unable to join us today. Next slide, please. We realize that your time is extremely valuable. And so these sessions are limited to 30 minutes with the learning portion at 25 minutes and 5 minutes at the end for questions and comments. Our team will remain in the room after the session's 30 minutes, just in case you have additional questions or comments. Slide, please. Comagine Health is providing 0.5 nursing CEUs for each of these learning sessions, and you will need to attend all 30 minutes and complete the evaluation after the session to receive the CEU. During last week's session, Charity shared how the Kamishi Buy or K-card system can help assure important information is getting shared about residents in timely manners. Then Dr. Ong discussed how to improve communication with providers through effective SBAR discussions. Today, Rita will share how to engage the resident and families in sepsis prevention. Rita?
Thank you, Connie. Good morning and thanks for joining us today. I am Rita Okando Igwe and I have a bachelor's degree in nursing and I've been a registered nurse for 18 years. I'm an improvement advisor here at Comagine Health. I have been with this organization for over 7 years. I started as a clinical care coordinator and I was embedded in long-term care facilities. I worked with the leadership team and frontline healthcare workers on initiatives to reduce avoidable hospital transfers among long-term care residents. I also have experience in medical surgical nursing, rehabilitation nursing, OR, and long-term care. Next slides, please. Oh, sorry, we are there. Today is our learning series, Working Together to Prevent Sepsis. In week 1, Charity in detail covered what sepsis is and why early recognition is so important. In week 2, Whitney highlighted assessment and early recognition tools and how to use them. Last week, Dr. Ong and Charity demonstrated the role of effective communication in preventing, identifying, and treating sepsis. Today, we will be strategies for engaging residents and family in sepsis prevention. We will learn the concept, the benefits, how to overcome barriers to resident and family engagement, and identify the magic wand for preventing sepsis. Next slide, please. Resident and family engagement is one concept of person-centered care, a philosophy that recognizes residents and their families as individuals and active members of the healthcare team, and provides care that reflects dignity, respect, please note, information sharing, participation, and collaboration. To engage residents and family, a positive relationship must be in place. Attention must be paid to the residents' needs and preferences. The residents and family must be made known that resident and family-centered care is your priority and be encouraged to participate. Also, the staff must be equipped to model that. Next slides, please. You may utilize the talk process to enhance your team's habit of engaging residents and family. Your team must make communicating relevant information part of their practice. For instance, instead of telling a resident that the doctor wants you to drink more fluid, or I need to insert an IV line in your hand, the reasons for recommending increased fluid intake and inserting IV line should be communicated as well. You and I know that most residents would not say a word to you unless they are prompted to. Therefore, our team must learn how to engage them in conversation while providing care by asking and inquiring. One of the greatest virtues to possess as a healthcare provider is attentiveness. Your team must be active listeners to engage residents and family in healthcare activities. One of the reasons residents may not feel comfortable to communicate with care providers is because they do not think we are good listeners. One thing is to listen and hear about those worries, concerns, questions, complaints. Another is to know how to address them effectively. Therefore, your staff must be equipped to be resourceful. Next slide. Now let's look at the magic wand for preventing sepsis. It is said the prevention of illness is better than the cure. The definition of magic wand means finding a simple solution to complex problem. Therefore, the simple solution to sepsis is sepsis prevention is the simple solution to sepsis is infection prevention and vaccination. The argument might be vaccination is part of infection prevention, but not all infection can be prevented with vaccination. For instance, wounds cannot be prevented by vaccination, but could lead to sepsis when infected. Therefore, both goes hand in hand in preventing sepsis. Come with me to the next slide. Let's explore more. Next slides, please. Magic 1-1, infection prevention. Sepsis could be a complication of any infection caused by bacteria, viruses, fungi, or parasite. One vital step in sepsis prevention is infection prevention. You and your team must have a process for engaging residents and families in practices that promote infection prevention. Comagin Health has a one-page resource titled Quick Guide for Engaging Residents and Families in Infection Prevention Practice in Long Term. It's already in the chat. I recommend you grab the link in the chat and learn ways to engage your residents and family in practices that promote infection prevention. Next slide. In continuation of our discussion on infection prevention as a magic wand for preventing sepsis, let us look at the 5 rights in engaging residents and families in infection prevention practices. The right information must be appropriately identified beside primary or basic infection prevention education, such as hand hygiene, care, oral care, cough etiquette, how germs spread. Education may target another aspect of infection prevention unique to the resident's medical condition. For instance, educating residents on the risk of folic heart, central lines, and the importance of cleaning and disinfecting them to prevent infection. Because there are situations whereby residents may not cooperate with cleaning of and caring for these devices. Now, right person must be identified, because not every member of the family is part of a resident's care. Therefore, information must be made available to the right persons. Learning materials could be provided in form of handout signages on the patient's portal or newsletters. Whichever format that makes information sharing effective should be used. Channel. The right channel for sharing information should be properly identified. The entire team must be prepared to take advantage of any opportunity available to educate their residents and families. Infection prevention we recommend that infection preventionists could make this as part of her practice. She could have a process whereby she completes a new admission visit within 72 hours of that admission, like within 3 days the facility is in your building. She could go in and visit with this resident. For example, I am Paula Smith. just to demonstrate what your IP could be, saying or should be saying to the residents. I am Paula Smith, the infection preventionist here at Comagene Health and Rehab. Our primary goal as a team is your safety. We want to ensure you do not contract any infection during your stay in a facility. Therefore, I encourage you to always communicate any new signs and symptoms or changes in your health with our team, preferably your doctor, nurses, and CNA. Practice good hand hygiene and encourage your family and loved ones not to visit when they are sick. During this visit, the infection preventionists will provide targeted infection prevention education related to the resident's medical condition. If the resident is at risk for sepsis, ensure that resources are provided to enhance the resident's awareness of early signs and symptoms associated with sepsis. The IP nurse must be prepared for this visit by reading the H&P and learning about other infections the resident is at risk for. Next slide. Another magic word for preventing sepsis is vaccination. Most infection can be prevented with vaccine. An example is pneumonia, which could be prevented with pneumococcal vaccine. It has been noted as the leading cause of sepsis, causing about 50 episodes annually, and 1.3 million ED visits have pneumonia right diagnosis. Therefore, residents and family must be educated on the importance of vaccines in preventing sepsis. Please follow me to the next slide. Let's outline the steps in bolstering residents and family participation in vaccine. Thank you. First step or first is a process must be in place for reviewing the resident's immunization history on admission to learn about mixed and eligible vaccines. Education must be part of your residents and family education. Sorry, vaccines must be part of your residents and family education. All vaccines must be made available, accessible for your resident. Ensure to collaborate with outside vendors for delivering and administering vaccines as needed. There may be delays in administering vaccines to the resident because the assigned nurse is uncomfortable administering them due to lack of skills. All the clinical team must be trained in vaccine administration. Ensure you have a good vaccine administration documentation and tracking process. Let's go to the next slide. Where should we begin our efforts to prevent sepsis? It should start from the pre-admission and admission phase of every care transition. Your admission team could add it as part of their process to complete sepsis risk assessment during their visit with a referred admission, or ensure it is completed within 24 hours of admission. The Healthcare Quality Innovation Network has a good sepsis risk assessment tool you could use to assess your residents for the risk of sepsis. One fascinating thing about this tool is that it has high risk rounding tool on the last page that will be used to round, you could use to round on any resident identified to be at risk of sepsis. Also, it is essential that residents and family sepsis education is outlined in the plan of care for such residents. I recommend you grab it, and the link is already in the link, and explore it. Let's go to the next slide. I recommend, like in our conversation, we've made mention of education resources. I will recommend that you create a sepsis educational packet for residents and family. Again, the Healthcare Quality Innovation Network has a one-page resource titled Resident and Family Guide to Understanding Sepsis. Please, I encourage you to grab the link in the chart. And the CDC has a good one too that you could use to create educational packets for your residents and family. Next slide. Are there benefits associated with resident and family engagement? Yes. When efforts are in place to educate residents and family in sepsis prevention, there will be better resident outcomes. Residents and family will be satisfied, healthcare costs will be reduced, and safety and quality will be promoted. Next slide, please. As you make residents and family engagement part of your culture, some factors may stand in the way, and to overcome them first, you must have a process in place for identifying those potential barriers. You have to interact with your staff to learn about the challenges they have with the culture of engaging residents and family. I'm telling you, some healthcare or clinicians or staff, especially nurses, are not comfortable when it comes to dealing with family members. We have to interact with them to learn what makes them uncomfortable in doing that. Ensure the leadership team is on board. You may appoint a resident and family engagement champion, and a plan must be in place to tackle each barrier as you identify them. Next slide, please. Collaboration is the key. Collaboration is the key. There are entities and groups you could collaborate with to build a strong process that promotes residents and family engagement in practices that prevent infection, increase vaccination acceptance, and sepsis prevention. Some of them are Patients and Family Advisory Council, Long-Term Care Ombudsman, Facility Activity Department, Medical Director, the State Department, and QIO like Comergent Health. Next slide, please. Important facts you must remember. I recommend you grab the link to this video on this slide here. I recommend you grab it, put it in your pocket. Please watch it whenever you get a chance. It will better help you understand the residents and family engagement in preventing infection. I recommend you just please watch that video at your convenience. We just want to look at points you have to remember, wrapping up this presentation today. Remember that infection prevention is everyone's business. It is a global responsibility. Everyone has a responsibility to help stop the spread of infection. Patients and family members are essential partners in infection prevention, and they must be seen as part of your team. Infection prevention education includes patients and family. Vaccination are important tool in the fight against infection and is essential in preventing sepsis. Effort to prevent sepsis must begin from admission. There are many resources out there to help you improve residents and family engagement in infection prevention. Next slide, please. Now, what can you do today? Having sat on this call today and been opportune to hear this presentation, what will be your takeaway? What can you do differently today? I recommend reviewing and updating your admission process to include sepsis risk assessment if it is not there already. Ensure processes in place to review all returns from acute care to learn of any diagnosis of sepsis for improvement opportunity. Review and update your admission packet to include educational materials for sepsis, infection prevention, and immunization. Next slide. Discussion time. Now, we do not want to assume what you are doing in your facility, but we want you to have opportunity to tell us how you have been able to help prevent sepsis and what you're doing currently with sepsis in your building. Next slide. So on the screen, we have identify a couple of questions to kind of prompt you. It's not kind of restricted that you have to go orderly. We want you to feel free to interact with us today and share with us how and what process you have in place to ensure that your residents and family are engaged in infection prevention practices. So we want you to take yourself off mute, share with us what do your staff know? How well does your staff know about sepsis risk associated with sepsis as well? What tools do you have in place to identify it and communicate it for early treatment? Do you have a process in place for reviewing your acute care returns? Does your admission packet include sepsis education? Feel free to tap in the chat. Feel free to take yourself off mute. Or what is your need in preventing sepsis in your facility? What do you think is a challenge for you? Just we want to open it up to a conversation right now. Hi, Tamiko, Raquel. Is there anything about sepsis in your building you want to tell us about? Isa Anderson. We have Wanda, Laurie, Kimberly. Does anyone want to tell us one or two things you're doing at your facility to help reduce sepsis? You all are quiet.
I'm curious if anybody has a committee or a team that looks at readmissions or admissions, initial admissions, to see if this person had a diagnosis of sepsis while they were in the hospital prior to coming to your facility. Kimberly says reviewing with physicians to use the order set. That way we do not drop a second lactate level. That's a great thing. Physicians are important to have on this team also. Does anybody communicate with the hospital to make sure that they are getting you the information that you need? Do you have a relationship with the discharge planners? So you have that information available that they did have sepsis, because they will be at risk again.
It looks like there's a couple comments in the chat. It looks like Kimberly said they're working on reminding staff to make sure that blood cultures are drawn before the antibiotics are hung. That's a great practice. It looks like Wanda said we meet weekly to discuss skin issues, medications. However, we don't have any current residents with history or current. It can be hard to determine change in LOC, I think that means level of consciousness and behaviors, since they are specialized in psych. Yeah, Wanda, that's a great call out. And I think a lot of that goes back to, how we talked in some of our earlier sessions about those early changes, really recognizing those residents' baseline and what their baseline is, so then we can catch those early changes sooner for those residents. I'd love to hear if anybody's working with their hospital discharge planners, like Connie was wondering. Connie, do you want to You had a nice intro for how people were working with their hospital discharge planners. Do you mind describing that again, or how they could be working with them?
Yeah, we've got Kay Fulmer. I'm sorry, I don't know your first name, but she says we meet every time that we have an admission and discharge, paying close attention to spreadable infectious conditions, make decisions at that time on what we are able to do for them, and ensure that that there are special items included in their care plans, and working with them on how. My question, got to remember how I said it now. Um, do you have a relationship with your discharge planners? Do they share the information, make sure that you have the information that you would need? Do you feel comfortable calling and talking to them about what their conditions were in the facility? I mean, in the hospital, for example, if they went with the UTI, did anybody follow up with the discharge planner to see if they got a sepsis while they were in the hospital, if they ended up with sepsis? Kimberly says we work with our discharge planners in that if we have questions regarding the information that they sent, so that we can ensure we are making responsible decisions, requesting more information as needed in the areas that we require. That's great. She goes on to say, my hospital has daily meetings with staff and physicians regarding patient discharges, what challenges in discharging are experienced, no safe home, insurance, etc. Okay, well, thank you so much for staying on and communicating and sharing with us. We really appreciate it. And we will close now and let you have the rest of your afternoon. Thank you again for joining us in this series. Goodbye.